the involved patients, the patients with multiple medical comorbidities and multiple medical diagnoses who come to spine fusion are complex in lots of different ways. Their underlying medical conditions make the parameters for taking care of them very different. Their particular curves are potentially very different. The curves occur in different severities. The curve can have very different effects on their overall functioning. So if you have very stiff hips or very stiff knees or have a great deal of spasticity, then the curve occupies a different place in the overall care of the patient. So both from the curve point of view and from the medical point of view, everybody's different. So there are many, many different variations on the situation. And the third is age. Depending on the age at which the child comes to the level of potentially needing surgery, different decisions need to be made. So from the surgeon's point of view about just deciding what operation to do and what anesthesia to do and how to get the patient through this, it's very complex. And that says nothing about the complex decision making on the part of the other caregivers and on the part of the parents.
Well, the issue is that you have this underlying neurologic disease that's affecting the curvature of the spine. And that neurologic disease is severe enough to do that. Usually it means that it's affecting the other organ systems of the children's bodies, right? Because your nervous system innervates everything. So a lot of these children end up having additional comorbid conditions which affect their health, their ability to digest food, to urinate, to stool effectively. They have bone problems, they have endocrine problems, cardiovascular, respiratory problems. And all of those issues come into play when thinking about how healthy a child needs to be to undergo the operation, and how all those health issues might affect their recovery. And I think all of that sort of weighs in also on whether we think the surgery should be done or not and how effective it might be. And as Dr. Emans was saying, every child is different. Their underlying neurologic condition may be nuanced. Their comorbidity profile is distinct. And so you've got to really approach each child differently to be able to figure out those answers and figure out how to proceed.
It's a little bit like a moonshot in that there are lots of different things going on that are changing, and they all have to be as good as they can be for the rocket to take off. So if you recently had an upper respiratory infection, then that's a bad launch. If you recently lost weight, that's a bad launch. But all of these different things make a difference. So if most of them are okay, then probably things will be okay. But if all of them are okay or as good as they can be, then the chance of getting through the surgery without a problem increases. So.